Hi, I'm Gina. I'm a nursing student and I've been assigned to shadow you today.
Oh, great.
May I have the S bar on your patient in room 529?
Yes, room 529 is Marta Yarn. She is 80 years old. She has no allergies. She's full code. She's on a regular diet, but tonight she's NPO after midnight because she's having a surgical debridement tomorrow. Her physician is Dr. Jolly. She came in with non-healing ulcers 3 months ago. The breakdown started about 6 months ago. She's going to have the surgical debridement tomorrow. She came in reporting dry, scaly skin. She uses lotion occasionally. She says she occasionally has stress incontinence with nocturia. She states a decrease in appetite. She complains of general weakness and an increased fatigue and weakness, including lower back pain, and she usually takes acetaminophen to do the trick. Her history is that she has had multiple admissions for dehydration and pneumonia, and the medication we're going to give, we're going to want her to increase fluids anyway, so since she's dehydrated, we're going to really stress that. She does not require O2 therapy, and her previous history, she doesn't smoke. She says she's never smoked, and she has no history of heart disease. From my assessment, her heart rate was 88, respiratory rate 24, which is high. The O2 sat with 92. BP was 144/90. Her temperature was 99.1 degrees Fahrenheit. Again, a little bit high. And her pain was 6, but she was just given a Percocet, so we'll kind of see how she's doing with that. Her physical exam, like she said, she had dry, scaly skin. She has a stage 3 ulcer, which is 4 centimeters by 4 centimeters and about a centimeter deep right on her sacrum. Her back pain, she says, is of aching quality. She's had it for the last 3 months. She is slightly hard of hearing. She has limited visual acuity and watery eyes. She has diminished lung sounds bilaterally at the bases. Her urine is amber in color, and the IV that we're going to give the med is in the right hand. So otherwise everything was normal except for those. Her current meds are normal saline with potassium chloride continuously. Then we're going to give her a gentamicin injection, and that's given every 8 hours, so she's due for that. It's within the hour time range, so we're good. PRN is the IV morphine sulfate and the Percocet. She was just given the Percocet. If she's still in pain, a little bit later we'll check and see if she needs the morphine sulfate. Her lab results, her protein is a little bit low at 11.6. Her white blood cell count is high. Her lymphocytes, 4,500. Her monocytes were also high, 720. And we did a culture and she had E. coli, so that kind of coincides with the white blood cell count being high, the lymphocytes and the monocytes being high. She lives alone, she's widowed, she's 2 children that live out of the state, so she's essentially kind of on her own. She uses a walker to get around. So what I recommend, we're going to go in there, we're going to check her pain. If it's not reduced, we'll give her the morphine sulfate. We're going to turn her every 2 hours to get her off of that sacrum, and she has a wound consult tomorrow and that surgical debridement, so NPO after midnight. We're going to monitor her oxygen levels and lung sounds, assess the IV site, make sure there's no swelling, no redness. We are going to administer the IV antibiotic therapy, so the gentamicin injection, and then our continuous is the normal saline with potassium chloride. And Dr. Jolly wants her to increase her nutritional intake, specifically protein, so we're going to teach about that, but also remind her that she can't start that until she's after her surgery tomorrow. And with her stress incontinence, we're also going to emphasize that she performs Kegel exercises. So that's about it for her
cool. So you said she's going to receive an antibiotic. Why specifically is the client receiving this medication?
Well, her culture came back positive for E. coli, and gentamicin is an anti-infective.
Oh, great. So what action does the medication have on the body?
Gentamicin is an aminoglycoside. Aminoglycosides are bactericidal, meaning that it kills the bacteria, and it inhibits protein synthesis, which is going to disrupt the cell membrane of the bacteria.
Okay, so when should you question administering this medication?
So we're going to use it cautiously with renal impairment, hearing impairment, and neuromuscular diseases such as ataxia. She is slightly hard of hearing, so we're just going to have to monitor her a little closer. It's contraindicated if there's hypersensitivity to aminoglycosides. It says here there's no allergies. We'll go in there and check that she has no allergies just to be safe. Also, we want to be careful if other antibiotics are prescribed, because while some can work in conjunction with the gentamicin and help it work better, there are some like chloramphenicol that reduce the efficacy of the aminoglycosides.
Okay, so does the medication have a therapeutic serum level?
Yes, its peak range is 4 to 6 micrograms per milliliter, and the dose adjustments are going to be necessary if she's having any renal toxicity. And we're going to monitor the blood levels to also prevent the ototoxicity and nephrotoxicity.
Okay, so what vital signs should be monitored?
She has an infection, so we're going to continue to monitor her vital signs. Her respiratory rates was a little bit high and her temperature was just a little elevated, so we're going to continue to monitor those closely. And we also want to monitor the wound appearance, sputum, urine, stool, white blood cell. We have a baseline already, so that's going to be good when we compare the current to it later.
Okay, so what physiological parameters should be monitored when the medication is being administered?
We want to check for toxicity overdose. So we're going to monitor the blood levels periodically during therapy. We have a baseline for before, and then we're going to check her blood again 30 minutes after, and we'll document that. And again, the peak range is 4 to 6 micrograms per milliliter, so we just kind of want to watch that range.
Okay, so what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So we're going to make sure that she drinks plenty of fluids and stays well hydrated. She has a history of dehydration, so we're going to need to reinforce that even more so. And then we're going to observe for and advise the patients of any signs of an adverse reaction to the medicine.
Okay, what interventions must be taught for taking the medication safely at home?
Well, this is an IM or IV medication, so she's probably going to be in here until her infection goes away, so I don't think that she'll be administering it at home. If she did, we'd probably have home health care give it.
So what are the side effects and potential adverse reactions?
So the adverse reactions that we're going to want to warn her of is the renal toxicity, ototoxicity, which is both vestibular and cochlear. So she'll notice balance issues or hearing, maybe vertigo, and ataxia. And then we're going to observe the patients for any allergic reactions, so rash, itching, wheezing.
Okay, so how will you know the medication is effective?
We are going to know that it's effective because all those levels that I mentioned before of the white blood cells being high, those are going to lower and decrease to normal limits. And then if there's no response within 3 to 5 days, we're going to take another culture.
All right, cool. Are you ready to go give this medication?
Yeah, let's go in there.
Let's do it.
Knock, knock, knock.
Come in.
Hello. I am
Hi.
Nurse Shelby. This is my student, Nurse Gina. We're going to give you your antibiotics today. Can I get your name and date of birth before I get started?
I'm Marta Yarn, and I'm 80.
Okay. How's your stay going?
Oh, it's okay, honey.
Good. You're given Percocet a little while ago. So have you noticed any decrease in pain?
Yeah, I feel okay now. It's about a 2.
Okay, so since it was just given to you, we're going to wait a little bit longer, see if it stays there. If it increases at all, then let us know, and we can give you your morphine sulfate, which is PRN.
Okay.
Okay, Marta Yarn, 80 years old. Okay. And do you have any allergies?
Nope, I sure don't.
Okay, good. That red band's on there, but it just says no allergies.
Okay.
Okay. So we're going to give you your continuous normal saline with the potassium chloride in it. And we're also going to give you a antibiotic. So I just want to give you some information on that because you have the right to refuse if you don't want to take it. So it is gentamicin. The peak is 15 to 30 minutes and the duration is 8 to 24 hours. You're getting this every 8 hours. If you notice any hypersensitivity, rash, tinnitus, so ringing in the ear, dizziness, or if you have any trouble urinating, please let us know. Okay, do you want to continue with this medication?
Yes, honey. That
Okay,
sounds good.
great. Okay, so the first one is the sodium chloride. I'm just going to pull that out. Going to check it with the MAR. Good. Okay, and again, you said you had no allergies.
Nope.
Okay, I'm going to scan your ID for this, and then we'll flush you. So we want to make sure that we'll check the IV site, make sure that it's open, so that if this gets through, then we know that the medication can get through. Okay. So we're just going to wipe this clean. There's no redness, no irritation.
Nope, it feels okay.
Goodness, Mr. Schwab must have put this one on. Okay.
He's so strong.
Let me get another IV, or alcohol swab. Okay, so I just want to keep that nice and clean. Yeah, so no redness, no irritation. It's not bothering you at all.
Nope.
Doesn't feel warm. Sorry, it's in your hand. Doesn't feel warm. You know what? Okay. So you're not feeling any irritation. It's not bothering you.
Nope, it feels fine. And so I don't break my back, I'm gonna lift the bed. Good luck. They don't always lift. Oh, there you go.
Slow and steady wins the race. Okay, so that is open. The site is good. Okay, so we have the potassium chloride. Again, I'm just going to check it against here. Good. We make sure there's no holes in it. It's not cloudy. It's not leaking or anything. It's kind of a personal preference of whether you want to hang it and spike it or leave it flat. I like to leave it flat just so there's no spills. Can you see?
Mm-hmm.
I don't need to miss a thing. All right. Check. And before you come in the room, when you check the name, that kind of counts as the first check, and then we've asked him twice for, or her twice for her name and date of birth. These are sterile, so as long as you don't touch either end, then you are good. Okay, and then we're just going to check this. Okay, we're going to prime the line. And basically the reason for doing that is to make sure there's no bubbles.
No bubbles, no troubles.
Okay, fill this halfway. I hang this now. Okay, great. No bubbles. This has the cap on it still, thankfully. This is the really sensitive part of the machine where it kind of tests the bubbles, so you really want to make sure that there's like literally like no bubbles in this portion.
Okay.
It's always easy to forget kind of how much you're supposed to give, so I like to double check. So sodium chloride, potassium chloride, 20 milliequivalents, 1,000 milliliter flag. Don't worry about that. I'll get it. And then the rate is 125 milliliters per hour. Okay, just entering the patient's ID.
Also, if you feel any kind of allergic reaction, itching, rash, hives, swelling, nausea, diarrhea, anything abnormal, just let us know.
Basic infusion. Again, the rate is going to be 125 per hour. So you just type that in. This is not liking me.
We're going to go out in the hallway and you have a nice day. Pleasure.
And the total volume of the bag is 1,000 milliliters. 1,000 milliliters. We'll put just a little bit less so it doesn't run dry.
I really do appreciate that. Thank you. Thank you for letting us see your shadow.
Okay, so then we're going to want to open this. We'll connect it and then open it. Then get my swab. It says it's occluded because I haven't connected it yet. Again, we cleaned this before and this blue is sterile. Oh, I cannot get these off with one hand. Oh. Okay, hold on. There it is. This should be the hardest part. Just in case someone gets a little nitpicky, I'm going to clean it again.
Did this information affect your decision to administer the medication?
So basically the answer is no, because there were no allergies. The white blood cell count was elevated, so that means we should definitely administer it. We checked with the doctor. There was no.
Okay, so when you restart, then you're just going to want to double check. Ooh, for the 5 drips. 2, 3, 4, 5. Okay, 3 means go, so we're good there. Okay, then the next medication that you're, I'm going to document, sorry, that it's where it is. So the right hand, time. So we check the right time, right patient, right dose, right drug, and the rate. And also with IV bags, you want to check the volume of the bag, which we double checked as well. And so I administer it so I can sign it. Okay, and then the next drug we're going to give is your antibiotics. So I have my fresh tubing. Okay, we're checking it with the MAR. Gentamicin injection, awesome. And I'm going to need you to scan again for this medication. So name and date of birth.
Marta Yarn, I'm 80.
Okay, so this one the pharmacy already made. It's supposed to be, it's 1 milligram for every kilogram of the person's weight. So she's 80 kilograms. So the pharmacy put in 80 milligrams of medication.
Okay.
That's right. I triple checked what he said.
Yeah.
I'm surprised you said green.
I had a printout of this. It's fine. It's just a little wet, so it's kind of hard to. Ugh. Okay. There's a barcode on here, so I'll just type that in real quick. It's a little more painstaking, but. And because I'm typing that, I'm just going to double check so there's no mistakes. D9 CCB 5. Awesome. Okay. I'll just try one more time. Let me see if there's another label over here. Ah, there we go. Okay. So we'll just attach that to the bag. Okay, so everything's going to be essentially the same for this. So we still want to prime, keep it sterile. There's obviously less fluid, so we're just going to want to be more cautious when we're priming the line. I'll take the old label off.
I'm gonna start taking it apart home at night with you.
Weeks or something, but somebody has a cart.
Okay, I'm just gonna check the volume again. Okay, so 80 milligrams per over an hour. Okay, awesome. This is sterile.
We're gonna be putting a
There's one clipboard, and then
we're gonna be putting a hose for them up over on this wall, so that we can turn that. But
I used too many of my alcohol swabs.
well, here's the other.
I'm not failing because of an alcohol swab.
Well, that one was here. They pulled it back over there,
Oh, okay.
so you guys can either work on it.
Oh, thank you.
I found
student,
one.
for
Students
finding
do
some.
come in handy.
Okay. This is still closed. So we're gonna connect this.
I gotta go. I can't
Okay. I scanned it. We are going to then, okay, so now we just put in the piggyback. So channel select is kind of always your base. You go to secondary. Sorry that this is taking me so long.
No worries, honey. I'll be here all day.
Giving gentamicin. We're giving it Q 8-12 hours. And it's already in here good, so the 80 milligrams per 100 milliliters. Yes, it's correct. So I'm just gonna open it so we don't get any beeping. And this is hung a little bit higher, so for gravity.
No, well, I guess I could, couldn't I?
Good. Okay, so then as this goes, this stops and then that runs that. So I'm just going to document. And like I said before, we want to check her blood in 30 minutes and we'll put that in. I'm also going to document that she doesn't want the medicine and that her pain, she said, was at a 2.
Uh-huh.
So if someone goes in here and is like, why didn't she get her meds? They'll know. Okay. Also, you want to make sure that you label your tubing so they know when to throw it out. So just put these on there. Okay, so that's labeled. Everything's running. The green is good. That means that we set it up right. Dr. Jolly also wanted to make sure that you were on a high protein diet, or not high protein diet, but just increase your protein. So we want to focus on increased protein, and we want to increase your fluids as well. But this is all going to be after your NPO for 12 hours, or for after midnight. So after midnight, you're not eating anything because of your surgical debridement. You have a wound care check tomorrow. So yeah, so just want to increase your fluids, and we want to increase your protein. So red meat, fish, chicken, all of that is really good. So quiz, give me one side effect of gentamicin.
frequent urination or painful?
Yes, painful urination. Good. Okay. Also with a rash, the dizziness, the stuff with
Yeah.
your hearing, so whether you're dizzy or tinnitus, and then what's a high protein food?
Fish.
Awesome. Good. Okay. So I'll leave those so you can study those. I'm gonna when we leave the room, I'll document the teaching.
Okay.
You didn't refuse the medication, so we're good. All right. Do you have any questions for me?
No, I don't think so. I'm okay.
All right. I'm just gonna lower your bed. When this starts ringing and driving you crazy, you'll probably wake up. Just give us a call. And then I see that your call 8 is right next to you. So if you need us, let us know. No questions?
Nope, I'm good.
Okay.
I'll let you know if anything feels funny.
Yep. And so we checked earlier the 5 drops here. As I was doing this, I checked the 5 drops here as well. Just make sure that the medication's going so that you don't leave the room and the medication stays sitting there. So 5 drips, 5 drips. Everything's working. Green go. Green means we go, okay? So I hope you have a great day, and if you need anything, let us know.
Okay, thank you.
Just wash my hands before I leave. Okay, Gina, did you learn anything?
Yeah, that was great. Thank you so much. So I just have a couple questions. Were there any pertinent pieces of information you reviewed before administering the medication?
Yes, well, we checked the 5 rights. We checked to see if she refused. We checked the right patient, right dose, right route. All the 5 rights, and also the you add volume to that as well.
Okay.
And then also we double checked her allergies. She had none, and we double checked the medication. She wasn't on any other antibiotics, so we didn't have to worry about anything not working together. And I checked her baseline for the white blood cell count so that to make sure we had one. So when we're checking later to see if it's working, that will
Oh, okay,
have a
great.
baseline. And then also we are going to go back in there in 30 minutes. So I wanted to document that and check that.
Cool. So did the information affect your decision to administer the medication?
Nope, she had no allergies. She's not prescribed any antibiotics, so we were good to go.
Awesome. So did the information affect how you administered the medication?
No, gentamicin is IV or IM, and her IV was patent, so we gave it IV.
Wonderful. Well, thank you so much, and I hope you have a great day.
Thank you.